Hi, well, hello everyone. I'm here with Ashish, and today we will be talking about chronic illness and resilience in chronic illness. Well, Ashish, if you could introduce yourself briefly.
Hi, good morning, good afternoon, everyone. Thank you, Dr. Astera, for having me on this call. My name is Ashish Parekh, and I currently live in Nashville, Tennessee, and I work for 10 Care. And just through our LinkedIn conversations, Astera and I had just brought up the topic of resiliency, and we just decided to share this with the LinkedIn family and just see, express our journey and how we're staying resilient, and just offer everyone hope that you can get through any situation that comes your way.
Yeah, exactly. As you said, I think that we should also bring awareness to different chronic illnesses that are there. And I think that both of us can actually contribute to that because your illness is quite not a very common one, and mine is maybe not that common, but it still affects quite a lot of women, and there is still not enough awareness out there. So I've decided to speak on and tell to everyone about my journey with my illness and how I've managed to stay resilient and how I've overcome different challenges. So if we could start maybe briefly introducing our chronic illnesses so everyone know what we are talking about. So, well, if you take the lead.
Yeah, so I was diagnosed back in 2013 with a blood clotting disorder that's called antiphospholipid antibody syndrome. And that is a disease which causes your immune system to attack your own body, and it attacks normal proteins in the blood, forming blood clots. And also, it can attack the heart valves and form vegetative masses on your heart valves. And so in 2013, I had about a 9 centimeter mass on my mitral valve, and that had broken off, and I had a stroke. Um, and at that time, when the doctors did the workup, they asked if I had any previous blood clotting episodes, and I did actually have one in 2009 when I went to India for a family trip. I had a DVT at that time, and so I was in the hospital in India for a week. So they tied the two together, and they said, okay, you have what's called antiphospholipid antibody syndrome. And at that time, they said the best treatment was warfarin. So I was on warfarin for several years, and then further along, I can just talk more about my health issues. But I'll give the floor back to Dr. Ashish.
Okay, yeah, sure. So basically, in your case, there were some red flags before you actually got your diagnosis, right?
Yeah. Correct. Yeah.
Well, it was.
When the blood happened in 2009, they just saw that maybe it was just from the flight to India.
Yeah, exactly. A long haul flight. Yeah.
It just came up on its own, and then they kept me on warfarin for 3 months after that blood clot, and then after the fact, nothing happened for 4 years, and then bam, this mass on my heart had broken off, traveled in my brain, and I had to have open heart surgery to fix it. So it definitely was challenging. It definitely affects your life, but you just gotta stay resilient. Every morning you wake up, it's just a blessing, and that's kind of how I view life. So.
No, I asked about those red flags because you see, in my condition, it was the same. It kind of came out of nowhere when I was 35, but there were many red flags before. And my condition is endometriosis, and that is called sometimes endo, so I will refer to it as endo. And endometriosis is a illness that pretty much affects only women, though I read that there were some cases that men had it too. The problem with endo is that we don't really know where it comes from. We don't really know the mechanism behind the illness. it affects mostly women, as I said, because what endo is that the tissue that is similar to the lining of the womb, of the uterus, starts to move around the body and it implantates itself in different parts, usually in the ovaries or the fallopian tubes, different parts of the reproductive system. But that can also travel with bloodstream, for example, to the lungs, and in some rare cases, even to the brain. And what happens is, because this tissue is very similar to the lining of the uterus, it means that every month it thickens, and then when period comes, it bleeds. And because it doesn't have a normal way to get out of the body, like the blood from the uterus, it means that what happens is that blood stays wherever it is, for example, in the ovaries or in the fallopian tubes, and then cysts with this blood are formed. And that's, of course, not good, because what happens next is different inflammations around those cysts, and there can be also some adhesions, which means that some pathological stripes of tissue start to stick together different internal organs. For example, it can stick the uterus to the intestines, and everything inside gets stiff. It doesn't move as normally should. And then you learn that you have endometriosis because you have lots of pain. And that's the main symptom of this disease. And that's how you pretty much learn that you can have it, because you can have very painful periods. You can have pains during an intercourse. Also, different pains in your abdomen and lower back area, even between the periods. And that's pretty much what happens to the women who suffer from endometriosis. But that also differs. Some women suffer more, some women have pain which is still manageable. I must say that I'm the lucky one, and I have quite a mild version of endometriosis. So it's not that bad for me, but I know that there are many women out there who suffer every month and for whom pain management in endometriosis is a big, big challenge. So, well, we've introduced everyone to our conditions, and well, you've already told how you learned about it, right? Okay, so in my case, I was preliminary diagnosed with the possible endometriosis when I was 35, back in 2015. But I had some symptoms even before, because when I was a teenager, I had really, really painful periods, and no painkillers really were managing the pain sometimes. And that was like a red flag. But at that time, I mean, we knew that there is something like endo, because I remember even reading an article in my mom's magazine when I was maybe 12. But at that time, no one was really paying that much attention to period pains. You know, if you had painful periods, you just had periods that were painful, and that's it. They told you to take different painkillers. So basically, I was, you know, pretty fine during my teenage years, apart from the pain sometime, once in a month. And then it got a bit better. But finally, in 2015, I started having completely different problems. I didn't actually have at that time any pains with my periods anymore. But one day my period kind of started, and then it didn't continue. And then a few days later it started again. And that was a very unusual thing. So I was going at that time to Poland. So I've decided to go to my regular gynecologist. But anyway, I visited almost every year because, well, when you are from Poland, you pretty much go to a gynecologist every year. I know that it's not like that in every country. So I can't say that I didn't have proper proper care earlier, but it was just not visible. And at that time, when in 2015, I went to my doctor, she did the vaginal scan. It's like a wand that they put in your vagina, and they can scan, everything inside. And it turned out that I had quite a big growth on my left ovary. And that was, of course, something which shouldn't be there. So my doctor said that we will observe it for a couple of months or a bit longer. She put me on some hormonal treatment to get my periods going every month as they should. And she told me to get back a few months later. And also I was sent to get a blood test because, well, another possibility was that it could have been an ovarian cancer. So, but when I got the results, it looked that it wasn't that bad. It was just slightly elevated, that marker. And most likely it was endometriosis, as my doctor said. And then I went back to my doctor in, I think, like 5 or 6 months. And then it turned out that this cyst on my ovary was like double the size or even bigger. And that at that point, it was obvious that it needs a surgery. So I had surgery in 2017. And that was when I was finally diagnosed with endo, because the only way to diagnose endo is actually to either do a laparoscopic surgery or a traditional one, which they just cut you open, just called laparotomy, I think. And I had the second one. I had the traditional laparotomy because I think my cyst was so big that they decided to just traditionally open me with a C-section cut. And that was removed. And then I needed to go on medication. So that was pretty much my story. So how was with your medication? How did that work for you?
So it's interesting. I mean, just hearing your story and just your resiliency and just you being able to sit down with me today and we're having this conversation.
Well, I think you're even more resilient than me.
I think we're resilient in our own ways, but yeah, for me, like 2013, after I had open heart surgery and then I had the stroke, the main thing is like I had cardiac rehab, and it was the one thing that I want to recommend to everyone is that if you have any stroke or any symptoms of a stroke, it's important that you get neuro rehab as well, because if you don't get neuro rehab, the brain tissue is already damaged, and if you don't get that neuro rehab, it kind of hampers your growth or learning to relearn those processes that you had already learned up to that point. And so for me, my memory was affected. I was like not remembering things. I was just a completely different person. And for me, from 2013 on, after the fact, like I had taken the warfarin, I was taking warfarin every day. Then I think in 2016, I had another episode where I had severe abdominal pain. And at that point, the day before when I'd gotten went to get my INR checked, the lab said that my INR was a 10. And so usually like the INR goes from a 1 to 10, and your range should usually be warfarin between like a 2 and a 3. That means your blood is super thin. I mean, thin in the normal range. But mine was a 10, which basically meant like if I got in a car accident, they thought that if I cut myself, I would bleed to death. So they called me into the office and said, take vitamin K. And so then they went the next day and I checked, and then my INR had dropped down to like 2.5. So it said, okay, everything is good. But I guess at the same time, that vitamin K must have caused my blood to clot, and it threw some blood clots into my kidney. And so the bottom third of my right kidney was completely like had several blood clots in it. And so like I had this sharp pain, and then like I had a fever of 105 degrees. I was throwing up, and it just was a complete mess. So I went to the hospital, And at that point, they looked, and initially they thought that maybe like I had appendicitis. So they looked, everything was fine. They didn't think much of it. Then when I went the next day, again with pain and again with the fever, they said, oh, wait, let's do a contrast eye scan. And then at that point, they said the kidney was infected or infarcted. And they admitted me to the hospital. They gave me blood thinners. And then I went on my way. And then a few months later, I was in the hospital again. I had some episodes of Bell's palsy. So Bell's palsy is like the nerve on the side of your face gets infected from a viral. And so you basically lose feeling or sensation on that side of the face.
So it's kind of becoming like numb.
It becomes numb. And so like when I was just like, drinking water, like I had to like hold my mouth like that. And it looked like, oh no, I'm having another stroke. But luckily it was just Bell's palsy. So they gave me medication for that. And then I was driving home one day and like I noticed I had double vision. And I was like, oh no, not again. Because, double vision is like one of the hallmark signs for stroke.
Yeah, it does, yeah.
And then I went again to the hospital and they said, yeah, it looks like you have a new growth on your aortic valve. So the first valve, I had growth on the mitral valve. The second time I went in, they found a growth on my aortic valve. And they said, you're way too young for this. You need to go to Cleveland Clinic or like a Mayo Clinic and be treated by medical professionals. So I went up to the Cleveland Clinic, and the doctors at that point, they were phenomenal. It's like a team effort there. It's like 6, 7 doctors that work together with the residents, and they really like take care of the patient.
They really had a good caregiver. That's good.
Yeah, really great prescribing team. Really fortunate to have met all of those doctors. They really helped project me, helped change the course of my therapy. And they said, stop the warfarin. They prescribed me with Lovenox, which is an injectable anticoagulant. So I had to inject myself twice a day with Lovenox in the stomach, which is not fun, but by any means, if that helps prevent blood clots, great.
Yeah, exactly. It's not a choice. You can't really stop it, can you?
No, you can't. And for me, then I just continued on, just taking each day as a blessing, moving forward, just enjoying life as it is. It did obviously just affect I just couldn't be in too many stressful situations. I just needed to be in a situation where I could just let my skills come through that I've learned, harness my skills and showcase them, and just find a position that would allow me to do so what I had spent all my time in college and my previous education with. So finally, luck had it, I ended up here in Nashville, Tennessee, working for the state. I love this job. I love this state. I love the city. And I was connected here with the doctors at Vanderbilt University Medical Center. And again, here was a great team that really worked with me and really helped out with my case. And I'm really blessed. I think just having a situation or a disease like this, I think it humbles you to a sense that, you look at a person from the outside, you don't look at exactly like what is actually
when I'm looking at you, I wouldn't say that if I didn't know.
But, it's just one of those things, it was a journey just to go through 2.5 years of neuro rehab, 2.5 years, 6 months of cardiac rehab, and just completely change your life, change, your lifestyle and everything like that. But, I think just resiliency and just sticking to it, I think is the best thing. Because I think even like right now with COVID, I know there's so much unknown. We don't know what's going to happen. We don't know who's going to get
exactly.
sick.
That's true.
But I think you and I, having been there, done that, I think we can offer hope to people that, hey, we've gone to the lowest levels, we've risen back up. And that's what I think we want to share with everyone is that.
Exactly. It's definitely why we are doing that in the first place. Yeah, sorry.
No, I just want to say, no matter how dark it might seem outside, there's always light the next day. And I think both you and
exactly. Yes. That's what I wanted to add, that, even if you have a disease like yours or then like mine, it's a completely different thing. but still, you have to be happy from another day. You have to be happy when you wake up, and things like COVID, they are there, but they are not that threatening as probably to those who have never ever had problems like we did in the past. I remember when after my surgery, I was put on medication. That's like hormonal medication that you have to take. I was put on half a year hormonal meds that basically introduce you into the state of menopause. So I had like pharmacologically induced menopause. So all my hormones kind of, got slow. The estrogen, which is suspected to be related to endometriosis, was supposed to go down. And that's quite often a very difficult thing for many women, especially those who want to have children, because what it basically does to you, it makes you infertile for a while, as long as you take those meds. And the majority of women who are diagnosed with endometriosis, they are in their 30s and their 40s, which means they usually try to get babies. And that's pretty often how they learn that they have endometriosis, because all those cysts that grow in the ovaries and fallopian tubes, they not only cause inflammation, but they also mechanically block the reproductory system. So it means that pretty much it prevents, in many cases, the conception. So the egg can't meet the sperm. And that's how women usually learn that they have endo, because they start looking for treatment. They don't know what's the reason, but they can't get pregnant. And then it turns out it's endo. So when I was put on those meds that induced menopause for me, I must say that for me it wasn't that bad, because I've learned from other women, and I've read on the internet, on different pages for women with endometriosis, that it's a very difficult time. You get like all the symptoms of a proper menopause, and like you lose your hair and stuff like that, and you gain lots of weight. And it wasn't that bad for me, I must say. I was just getting those flashes of like heat sometimes, but that's not that bad. So I didn't really have to adjust that much, apart from taking my meds every day. I was gaining a bit of weight during that time, but not that much as later, because after those 6 months, I was put on a normal contraceptive pill to still, like, keep me on those hormonal medication, because it's better if you're actually taking those meds, because the bleeding then is much smaller, and practically there is lower risk that you will have like new endometriosis implants somewhere else in your body when you have this period while on meds. So I was put on this contraceptive pill for another 2 years, and I finished taking the contraceptives last year in June in 2019. Because pretty much this is what it is. If you take those meds for 2 years and you don't have any new growths, it means that, well, pretty likely you may not have them when you stop the medication, but you never know, they can always come back. But for some women, they get new growths even when on hormonal medication. So it's a bit like a lottery. But anyhow, I did what was the best for me. I took those meds for as long as I was recommended by my gynecologist. And then I stopped, because last year I was so tired with it, because hormonal meds, you would understand that there is a high risk of getting clots. And I was quite afraid of that. I started panicking with every pain that I had in my like lower part of my legs, or it was kind of like scary for me. And sometimes I had pains. I remember I even once had to go to my GP here in the UK, and they actually did the tests. Luckily, it wasn't anything, but that was that part that was quite hard for me to adjust to, because I had to take those meds as you have to take yours, but at the same time there was some risk, attached to me taking those hormonal medication. And I know, like, lots of women take contraceptives just for contraceptive reasons, but yeah, for me it was like a bit, it was always somewhere at the back of my head that, yeah, I can get clots or things like that. So and I also had lots of bloating. I gained quite a lot of weight during that 2 years when I was on those meds, and that was quite inconvenient, and not because of the aesthetics, but when you have to change your clothes every half a year, it's not really that funny. So yeah, I've decided last year to go off those meds, and so far so good, touch the wood. But I can see that now I still get like more pain that when I was on the medication, because when I took my hormonal meds, it was quite fine. I didn't feel anything, and once I went off my meds, I started getting a bit more pains here and there, but luckily it's not bad, so I can still manage with it. But if you could tell me what were the biggest adjustments that you had to make because of your condition and because of the medication that you have to take on a daily basis?
So, I mean, there's two things. Like when I first was on warfarin, I think the adjustment there was when you're taking warfarin, it's affected by the food you eat. So you can't eat a lot of salads. Like you just can't eat all salads. Like you have to like balance it out. So that was an adjustment with the way you ate your food. But then once I switched to Lovenox, obviously, like anytime you get a cut or anything like that, it's a risk because you're on anticoagulant, so it's going to take longer for your blood to clot up. And then also with the Lovenox, one of the side effects is osteoporosis. So just making sure like you have calcium in your bones so that your bones don't get brittle and that you
So
don't.
the same here actually when I was on those meds.
And so I mean that's just an adjustment for me, and I think just trying to just remain healthy, exercise. I know life is kind of crazy right now, but that's just the main adjustment for me. But for me, I think this whole thing again, like it just relates to you've been through it, and you've come out from it. So I think it just makes you stronger, and you just want to share that hope with everyone else. Like you could be having a bad day, but look at our stories, and hopefully that gives you hope and inspiration that we've been there. Our situation might be different than what you're going through, but it's the philosophy is still the same, and that's what it's all about. Is just what
Yeah,
we've gone.
exactly. We are still here. We can, share our stories. We are talking about that, and you can see that we are smiling. We are not depressed because of that. Luckily, though, I guess we had quite a lot of bad days, right, during our journey, because I remember, at least for me, although for me the diagnosis of this condition wasn't that painful because I wasn't necessarily thinking of having children anymore at that time. So the fact that I lost my ovary, because I actually lost it, my left ovary had to go with the fallopian tube with the cyst. There were more cysts when they opened me, and it wasn't possible to save one of my ovaries. But still, for me, it wasn't such a great shock as for many women who would be in my shoes, because, as I said, I wasn't planning children anymore at that time. But nevertheless, it's kind of, it's not a nice thing when you think that a part of your body has to go, and still ovaries are quite important, because when they do not produce hormones, it means that you go into a menopause. And some women with endometriosis, they have to have a hysterectomy even at a young age when they are 20 something. And that means that at that age, they can't have children anymore. They go into menopause. As you said, they can get osteoporosis at the age of 30 or 30 something. So that's all kind of scary, and that's definitely daunting, and it's nothing to be optimistic about. But nevertheless, we have those conditions, and we somehow manage through. So
Yeah.
that's what we want to share. That it's important to work on resilience. And if you can tell maybe how did you manage to work on your resilience, and what was the outcome? What have changed in your mindset comparing to you from before the onset of your illness?
I think, when I had my stroke rehab, I mean, the folks at Fraser Rehab Center, they were really great. And then Dr. Hoover, she was also great in neuropsych therapy and cognitive behavioral therapy. And I think, like, when you go through a stroke and then you have all these health issues that I have, and then Cleveland Clinic, they had further diagnosed me with lupus and antiphospholipid syndrome. So it's like you have two autoimmune disorders. So that really does a number on your self-confidence. I mean, you can be
Yeah.
smiling, but it really, like, took me all the way down, and I had to, like, build myself back up. And, it was just through prayer, meditation, reaching out surrounding myself with positive people, and just, building myself back up. And I think for me, that's just one thing is what I did, is just to build myself back up, is like, I had to kind of rediscover myself. And every day you're rediscovering yourself and trying to surround yourself with that group of people who, will count on you, who'll support you. And, for me, that's kind of what helped get me through it. Each day, again, I wake up, hey, great, it's good. I know this past week, I think I posted on LinkedIn, when I woke up, I didn't feeling on the entire right side of my
Yes,
body.
I remember. Yeah.
And I was like, oh no, not another stroke. But I'd actually gone to the doctors at Vanderbilt Health Center, and they had said that, no, you just had an autoimmune reaction from your lupus, and that just caused your fingers to be numb and swollen up. So no stroke, nothing like that. So everything was good. It was a crisis averted. But again, every day you wake up, it's a blessing, and you just take the medication, the treatment, and if something happens, it happens. But you've been through it so many times, so now at least you can kind of be the doctor yourself. And
Yeah, exactly. You know your condition pretty well, isn't it?
yeah, but again, I think it's just communicating with your doctors and just communicating with the right people, and having that support group in your life helps make the difference. So
Yeah, definitely. You need to have people to support you. That's one thing that is quite important in all those chronic conditions that, well, we have or other people have. It's probably more difficult if you don't really have anyone that would be there for you. Well, for me, the biggest changes that I have noticed was definitely my mindset, because before I was diagnosed, I tended to work a lot. I made all those, long-term plans in my life, and I was really pushing, to get those things done. And I sometimes didn't really think about my health and about my, work-life balance. I spent really lots of time working. I really enjoyed it, but maybe I didn't really have enough time to rest. And after I was diagnosed, I started paying more attention to the time that I have to just, relax and detach from what I'm doing professionally, because one of the symptoms of endometriosis is actually fatigue. And I really started feeling much more fatigued in the last 5 years, more or less, starting at that point when my endo started, when I had this, first symptom that made me go to my gynecologist and have a checkup. And I really can feel these days that I don't have that much energy as I used to have before. And I think that this is pretty much endo. But that means that I needed to adjust my lifestyle. Well, regardless of the fact that I still try to focus pretty much on my professional life, now I need to take more breaks. Now I need to think more about, the balance between working and between time that I have for other things like relax or some other pleasurable activities. And also, I think that I have become more optimistic, probably because of the illness. Well, because as you said, it's that's quite a big thing, and going through it, it's not that much fun. But still, you need to find energy, and you have to find this motivation to get up every day, do your things. Don't think about all those health scares. Don't think about that something bad can happen, but you need to wake up, be happy that you've managed to wake up every day. Well, in my case, maybe it's not that serious as in yours, but still somehow, some women, they can have quite acute symptoms. They, if they have those cysts and they break, they actually need to go to emergency surgery. So it can be also life-threatening in the worst case scenario. So yeah, I think that we pretty much managed to stay resilient in our condition, and we are happy that we were able to share our stories with everyone who is watching.
Yeah, just to wrap up, just thank you again for this opportunity to partake in this conversation with you. And I think just resiliency is just the key. Stay resilient each day. If you have a challenge, just know that tomorrow is a new day, and just reach out to your support group and they'll be there with you. So,
well, thank you very much for telling everyone about your condition, because I think that my condition comes here a bit on the side. My motivation was pretty much to raise awareness about endometriosis, because I think that your journey and your resilience is much greater than mine, and I have lots of respect to you that you could stay so optimistic and so resilient for this whole time. Okay, well, thank you, everyone. And, leave the comments. Tell us what you think about it and what you learned from this podcast about resilience and how you can use it for building up your own resilience. Thank you for watching, and see you soon. Bye.
Take care.